Hi, I'm Dr. Kyle Stanley, and I'm the clinical director here at Paramount Dental Studio. 3D printed night guards are awesome. They work, they function well. However, a small percentage of them may be too tight or too loose in the patient's mouth. And there's easy ways to fix this when the patient is in the chair. Let's say it's too tight. If it's too tight, the first step you want to do is get a hot water bath. We have a hot water bath here at 68 degrees Celsius. And you can put the night guard with the 3D printed model into the hot water bath. And you can do this for 15 to 30 seconds and take it out, put it on, take it out, put it on, and then put it in some cold water. It doesn't have to be ice cold, just cold out of the tap. And what you'll see is that the night guard actually gets a little looser. So that's like a first step. Now let's say you've done that a few times, it's getting looser, you're trying it in the patient's mouth, but it's still a little too tight. You may want to go to step 2. Step 2 is taking a handpiece with a lab burr block, a lab burr, and a straight handpiece. And look for where you have undercuts. You can go and adjust these. And I mean, you're a dentist, you know where the undercuts are. They're gonna be in the canine region, they're gonna be interproximal, they're gonna be when you have flared teeth. So simply adjust those. Now, if you do this in combination with the hot water bath, the cold water bath, and using the lab handpiece, you'll be able to get this night guard that just totally flies. Now, let's say you have a loose night guard. You know, you put it in the patient's mouth, it's kind of rocking a little bit, one side comes off, oh, it's just this side that's a little loose. This is extremely easy to fix. Again, we're going to use the hot water bath. We're gonna put it in there 15, 30 seconds, and you're simply gonna crimp the sides with your fingers. And many times it's interproximally that you wanna do it, but just try that crimping and remember to put it back into the cold water bath. Try it in the patient's mouth again, you'll see that it's gonna be getting better and better. Now, anytime you're making adjustments, we do want to let it sit in room temperature for about 5 minutes, try it in the patient's mouth again, and you should be good to go. I hope these tips help you adjusting some slight little adjustments in your patient's mouth for your 3D printed night guards.